All right, so pharmacist interventions part 25. I had a patient trying to pick up eplerenone and spironolactone at the same time. You can't take these together. This is contraindicated. They're both in the same drug class. They're potassium-sparing diuretics. I usually see them for use in heart failure to decrease morbidity and mortality. This patient specifically, I believe, had heart failure with reduced ejection fraction. In these patients, stage C, we like to put them on 4 medications. So first, an ARNI like Entresto, or maybe an ACE inhibitor like lisinopril. We add on a beta blocker like metoprolol. We tack on a mineralocorticoid receptor antagonist like eplerenone or spironolactone, and then an SGLT2 inhibitor like Farxiga. So this patient wasn't sure which one he should be on, and I talked about the differences between them. So eplerenone is less anti-androgenic. Spironolactone blocks androgen receptors, so it can cause gynecomastia and breast tenderness in males. So I talked about the differences between those, and then of course only recommended picking up one of them. It's not good to take both again because same drug class, they both increase potassium levels. So this is because they block the activity of aldosterone. Aldosterone is a mineralocorticoid. So its function is to increase sodium and water reabsorption and then cause potassium excretion. So when you block that activity, you increase potassium levels, which can be dangerous. Next intervention, I had a patient who was on the younger side trying to pick up an Eliquis starter pack. She had a blood clot in her arm. Insurance actually ended up paying for it, but it was legitimately $700. So I decided to call the hospital, and I got a hold of the operator. I'm like, hey, transfer me to inpatient pharmacy, because I like to talk to pharmacists to get like things done with coupons and stuff. So I talked to the pharmacist. I'm like, hey, can you enroll this patient real quick for the free trial card? Because I have databases at hospital that they can just pull up sample cards and they'll just randomly auto-populate. And she gave it to me over the phone for this patient that was recently discharged. So these free trial cards are not available online. And then also retail pharmacists like can't call for them. They're like inpatient or like hospital or practitioner cards only. So I've asked before for Eliquis or Bristol Myers Squibb to give me those, and they said no. But I got this card for her real quick, and it was free. So it dropped from $700 to $0. So she picked up her Eliquis, and then I also talked to her about the $10 like copay card that she could enroll in for her continued fills, because she's gonna be on it for a while because it was an unprovoked clot.